Wuhan coronavirus, or the novel coronavirus.
Scientists believe coronavirus originated in wild animal market.
Experts say meat sold at wild animal markets in Wuhan is likely the culprit for the outbreak of the deadly coronavirus, which has so far killed more than 630 people and infected more than 31,000 globally. Similar viruses will continue to pop up regularly unless the root of the problem is addressed, scientists say. The new strain of coronavirus is believed to have originated in wild animals, possibly bats, before jumping to the human population. Lipkin said similar viruses will continue to pop up every couple of years if the problem of wet markets falls by the wayside. Coronavirus may have originated in lab linked to China's biowarfare program. The deadly animal-borne coronavirus spreading globally may have originated in a laboratory in the city of Wuhan linked to China's covert biological weapons program, said by an Israeli biological warfare analyst. China temporarily banned the trade of wild animals until the virus has been eliminated, the Associated Press reports. Experts say diseases can easily mutate and spread to humans interacting with these markets, where various species of both wild and domesticated animals are kept alive in close proximity. But authorities have failed to fully address these health risks over the years. While closing wildlife markets could have a major impact, bans alone will not stop the illegal wildlife trade if demand persists. The World Wildlife Fund said in a statement, "This health crisis must serve as a wake-up call for the need to end unsustainable use of endangered animals and their parts, as exotic pets, for food consumption and for their perceived medicinal value." Lipkin acknowledged that shutting down wild animal markets is a difficult decision that will end thousands of years of tradition. However, he said it is necessary to end the spread of viral diseases like SARS, MERS and coronavirus. If these persist, and human consumption of wildlife goes on, then we will continue to face heightened risks from emerging new viruses, potentially more lethal, WCS said. It is hard to design more perfect conditions for new viruses to emerge than market systems such as that in Wuhan. What is the coronavirus from China and what are the symptoms? Coronaviruses are a large group of viruses that can cause illnesses as minor as a cold, or as serious as Middle East respiratory syndrome, MERS, and severe acute respiratory syndrome, SARS. According to the World Health Organization, the viruses can be transmitted from animals to humans. The virus that causes SARS, for example, was originally transmitted to humans from a cat-like animal called a civet. But in some instances, as with this outbreak, they can also be transmitted from one infected person to another. What are the symptoms? According to the U.S. Centers for Disease Control and Prevention, the new virus can cause symptoms including fever, cough, and shortness of breath. Some patients only show mild symptoms and recover, but others have developed life-threatening complications like pneumonia. The CDC says symptoms of the 2019 nCoV virus can appear in as few as 2 days or as long as 14 days after initial exposure. How did the new strain start? The outbreak began in Wuhan, a city of 11 million people. Many of the early patients were linked to Huanan Seafood Wholesale Market, a large seafood and animal market in the city, CBS News' Rami Inocencio reported. But since then, a rising number of people have contracted the virus without exposure to the market. While the virus originated around Wuhan, cases have also been reported in Thailand, Taiwan, Japan, South Korea, Vietnam, Malaysia, Nepal, Singapore, the US, Australia, France, Philippines, and a growing number of additional countries. How is it transmitted? Similar to the flu, it's believed the coronavirus can be spread through droplets when an infected person coughs or sneezes. In one case, a hospital patient in China is said to have infected 14 medical workers, reports Inocencio. It also appears to be possible for the virus to be transmitted by infected individuals who are not showing any symptoms at all. U.S. health officials recommend washing your hands thoroughly and frequently to reduce the risk of illness. They say the risk for Americans remains low and there is no need to wear face masks for protection. For more update, please like and subscribe to my channel. Joanna Belchin.